Hi, I'm Rick Hess, Director of Education Policy Studies at the American Enterprise Institute. Terrific to have you with us here today for our conversation about the next conservative early childhood education agenda. The past year has highlighted the importance of childcare as parents have struggled to balance work, childcare, early education, and honestly, as a parent with a 4 and a 6-year-old here, their own sanity. It's also a safe bet that early childhood education is going to loom large, both at the federal and in so many states over the next 4 years. So this all raises an obvious question: what principles should guide conservative thinking in the early childhood space? More specifically, what policies, what ideas should conservatives support and embrace that can actually meet the needs of families and children in a manner that's consistent with the values we share? Today, we're joined by a terrific lineup of panelists to talk about just this. We've got Cara Candal, Director of Educational Opportunity at ExcelinEd, Elliot Regenstein, Partner of Foresight Law and Policy, Celia Sims, Vice President for Government Relations at KinderCare, and Chris Strausz-Clark, Managing Principal of Third Sector Intelligence. The way this is going to work is I'm going to let Elliot and Chris kick us off by talking a little bit about a new paper they just wrote for us at AEI on improving parent choice in early learning. And then I'm going to have some questions for Cara and Celia, drawing both on their work in this space and their experience. We're going to have a conversation for about 45 minutes, and then we're going to open it up for audience questions and participation. If you have a question that you'd like to ask, a couple of ways to get it to us. One is to just send it to our uber competent research assistant who's handled this event, Haley Sanone, at Haley, Hayley .Sanone, SANON, at AEI.org. That's Haley.Sanone at AEI.org. You'll find also the spelling on the event page, or you can hit us on Twitter using the hashtag conservative ECE agenda. That's hashtag conservative ECE, Early Childhood Education Agenda. Either way, feel free to hit us with your questions and we'll do our best to get to as many as we can. With all that, by way of intro, Elliot, Chris, let me turn to you to get us started. And you wrote this paper that we just published a week ago, Improving Parent Choice in Early Learning. What are a couple of the key takeaways, and how should folks on the right be thinking about both the challenges and opportunities of helping families with early childhood?
Well, Rick, thanks so much for publishing the paper and for having us on today. I think part of why we're honored to be here is that neither of us are self-identified conservatives, but we've worked in many conservative states with a lot of leaders who are trying hard to answer exactly the questions you're talking about. I also appreciate your framing of the importance of values and grounding policy in that, and that two of the core values I know you've articulated are empowering families and having a pluralistic system. That's really what our paper is about. So 2 big points we want to make to start out. I'm going to talk about one, Chris will cover the second. First, we believe there's an essential role for state government in early childhood, but right now states aren't really set up to play that role effectively. States need to get better organized if they're going to make sure that families actually are empowered in a pluralistic system. The second point is that without better information and the better technology to support it, even states that get organized will have a hard time coordinating services. So first, when we're talking about publicly funded early childhood services, really important to emphasize that the families we're talking about, by definition, are mostly low income. And of course, they have young children. So by definition, they're not going to have a lot of bandwidth. And they enter a market that can really be bewildering. There are multiple programs that serve them. One is subsidized childcare, where families try to find service in a very diffuse market. And if they meet certain eligibility criteria, they might get reimbursed for a portion of that. That's usually managed by a state human services agency. State pre-K is available in most states, but not all. Where it exists, it's usually free, but might have restricted eligibility. And it's usually managed by the state education agency. Then you have Head Start, which is always free, but it's only available to very low income families, and it's managed directly by the federal government. That's a system that's genuinely pluralistic. And in fact, to emphasize that point, all of those programs are delivered in a mix of settings: schools, dedicated centers, which could be for-profit or not-for-profit, and childcare is often delivered in homes. That pluralism is a strength, and there's important reasons why families choose each of those settings, but it only adds to the management challenge. There were often good reasons that states put childcare and pre-K in different agencies, but as they've grown and evolved, it's put a greater premium on getting organized to manage it all together, which has been a struggle for states. So if all these programs have their own requirements that are coordinated, it makes it really hard for providers and families. Getting that coordination right requires leadership in state government that's really empowered to work on this issue, to look at the entire sector and think about the whole, not just the parts. There are a few states across the political spectrum that have done important work in this area, others that are working on it right now. We can talk about that more later, but right now I want to turn it over to Chris to talk about the need for better information.
Thanks, Elliot. So I think I first need to emphasize that early childhood is a market, the obvious point, but I need to make it nonetheless, and that any market, with any market, you need information in order to make good decisions. So parents need information about how to identify a provider they trust and feel good about. Providers need information about parents, about how their services stack up to other providers, whether or not their options is subsidized rates when parents can't afford it. Now, one of the issues that we talk about in our paper is, unfortunately, that the early childhood market data is just historically been awful, frankly, and it's still awful. And this has a lot of implications. I mean, parents struggle to find suitable early learning care. We were just talking about this, prepping for this call, because of a lack of information. Parents have a hard time gauging quality, and sometimes there just aren't decent options, period. But it's even hard to figure that out sometimes in your neighborhood. Now, to their credit, I think states have really tried to help by funding various things like resource and referral networks and quality ratings, but it's hard to keep up. And one of the reasons why it's hard to keep up is because states themselves don't actually know which kids are getting which services for a large number of children. So, it's hard to oversee and participate in the market effectively when you're flying blind. Now, there are a lot of reasons for lack of good data, and hopefully we'll get into some of those in this webinar. But the good news is that cloud tech can really help reduce some of these barriers. Nowadays, cloud technology generally makes it faster to get information. It's easier to scale. It's cheaper to deploy and process. It's more convenient to collaborate. Now, I'm not going to sit here and say it's a magic bullet. And you do need to pair it with early learning expertise and experience, with governance, what Elliot was talking about. But there is an opportunity, and we are starting to see the field realize this opportunity. Although, again, frankly, we'd like to see faster adoption. So, we look forward to talking about the details more in this discussion.
Cara, Elliot and Chris talk in their paper about one of the challenges being that this pluralistic system is complex, and how each part affects the whole in a mixed delivery. But you suggested, including in an AEI paper you were kind enough to do for us last summer, that part of the problem here is that government's not just funding families to get services, but that a lot of these problems are actually a result of government trying to provide the services. Can you talk a little bit about how you understand that, why that is, and what public officials might do about it?
Sure, yeah. I mean, as you say, as I think has already been pointed out, there's a huge difference between publicly funding a service, which, by the way, in truly pluralistic education systems, we often see public funding of pluralistic systems rather than public provision of education. And so what you've got here is we already have a diverse market, as has been pointed out, but there's this push and pull around, we have to get more kids in, we have to get more kids access. And states are trying to do that in a couple ways. As is pointed out in the paper, you can do it with what's like a voucher, but it often doesn't cover the whole cost of what that parents need to bear. And certainly half the time doesn't cover both education and care, which, hello, we know it's a huge problem right now, especially that's been highlighted, right? We're all living it. But the other problem is that when what we're seeing in some places, when really it becomes publicly provided education, certain providers might be squeezed out of the market. States are generally only serving 4-year-olds, or the bent is toward 4-year-olds, or they're making big promises about let's get the 3-year-olds in. Again, that's an education and a childcare problem. And parents are simply left out in the cold. The other thing that happens oftentimes is it's like, well, there's this free public preschool over here. So what you're left with, as we said, it's usually low-income families that are using these because it's their only option. And so you're still left with an imbalance, with wealthier families having sort of this plethora of things to choose from. I want this Montessori education, I want this, I want that. And those who don't have as much, being left with that one singular option. So I think that I agree that states have a role to play. But right now, what they could do, what I would like to encourage us to think about, is take some of those resources that are already being funneled into providing publicly provided preschool, which isn't always effective. Sometimes some are better than others. And thinking about how instead you empower parents. So how do you make what looks like a direct payment to parents meet some sort of, you could scale it depending on income bracket, but come closer to the true cost of both education and some form of childcare. And then how do you incent this already diverse market to really get into the game and serve more of these children who might not come with the full cost of what it costs to go to, KinderCare every day. I don't know, but who we could get close. So this is a model that looks a lot closer to what we're seeing a huge push for, quite frankly, in K-12. I call them education scholarship accounts. I think that we could adapt this for preschool, but it's all about preserving pluralism, letting government play a role, but that role doesn't necessarily have to be in the provision of education.
Celia, I mean, it seems to what's been said, the logic of giving parents maximum options in early childhood seems to make obvious sense. People are in hugely different circumstances. We're talking about, and yet it seems like a lot of what passes for early childhood reform seems intent on limiting those choices. So I think, for instance, about how de Blasio's massive pre-K initiative in New York City. Can you talk a little bit about why it's playing out this way, why these reforms seem to be limiting choices, and what does it look like for us to both try to address these challenges, the fact that too many families don't have adequate care or any care, without just creating, bureaucratic institutions that may or may not meet family needs?
Yeah, I think there are a couple of issues coming through, and I agree with everyone from the front. I think more so than any other age group, 0 to 5, preserving parent choice has got to remain paramount. There is no other time when, children are developing at very different stages and have very different needs. And only the parent or the primary caregiver is the best one to make that decision. And for some, that may be a center-based setting like a KinderCare. For other children, being in a smaller family-based place is the best. I think what's been happening in the policy world that has been, while well-intentioned, we're beginning to see negative consequences, is when we still, and I've heard it in the conversation so far, this false dichotomy between education and care. A 6-week-old is still learning. So we may call that childcare, but that is still education going on, whether that's from a parent, whether that's from a grandparent, whether it's an essential, whether it's in a family childcare home. And what's been happening in the last couple of years, out of the desire, out of the research to say, early childhood matters, is there has become, I think, an obsession amongst policymakers with 4-year-olds, as if somehow magically only at age 4 do children start to learn. And so it's like 4-year-olds, and they make great photo ops. People would much rather be in a room with a 4-year-old than a toddler. So we have just seen this desire to serve more and more 4-year-olds, which is great. We love 4-year-olds, but they are 0, 1, 2, and 3 before they turn 4. And I think also because of this provision of this false dichotomy between education and care, there has been a belief that the public school setting is the easiest and best place that we can just magically provide care for a 4-year-old or education for a 4-year-old. The problem with that is it starts to reduce a lot of choice on low-income families, middle-income families, and the whatnot, because the moment you pull all the 4-year-olds and 3-year-olds out of the 0 to 5 system, all you've done is increase the cost of infant toddler care, because it takes a lot more adults to care for the younger ones. So again, I don't think anyone has been ill-intentioned, But we have to think of this as a continuum from 0 to 5, and also understand that, a lot of parents need more than a 3 to 6 hour program in a public school setting during a regular school year. And the childcare industry, in its vast array of, it can look messy because you've got family childcare providers and center-based and faith-based and for-profit and nonprofit. I think people just get, oh my God, what are we going to do? So just shove them over here and take the choice away to make it easier on the policymaker, which down the turn only makes it more difficult for a working parent in particular to have what they need.
So, and let's get a couple of just framing facts out here, guys. So, Elliot, I mean, how much money are we talking about in our early childhood in a given state or nationally? What's this cost? Like, can you give folks who are watching some sense of the numbers and the scope of what we're talking about?
Oh,
sorry, I had to mute just a second ago. Yeah, so, nationally, you're talking about billions of dollars, right? I saw a piece in Ed Week today that if Head Start was at the Department of Ed, it would be the 3rd largest program at the department. And the federal government's spending about $10 billion on that. The state preschool, again, there's huge variation across states. It's generally, in some states, it's much bigger than Head Start, and you're talking about hundreds of millions of dollars. In others, it's much smaller, more like a pilot program focused on 4-year-olds. So I think, childcare, what's important in childcare is that however much money is in the system, a lot of it's coming from parents, that there is federal and state subsidy. And again, there's, probably about $6 billion there's sort of billions of dollars of federal money, and there have been certain stimulus efforts that have spiked it at different times. Then you're talking about states adding in funds. And then again, much of the system is paid for by parent co-pays, even for low income families. So all in all, you're talking about billions of dollars, right, nationally. And that in some states, this is a relatively big budget item. In other states, it's sort of like the crumbs that get sprinkled out at the end of the legislative session when the big, when the big things have eaten theirs. And this is, this takes what left. But there are some states where early childhood is actually handled early in a state budget process as like, this is a big chunk of money that we need to get to.
So, one of the questions that immediately comes up is what Celia was just talking about, this temptation to kind of pull the 4-year-olds into structured pre-K. So, Chris, for instance, I believe you work in a lot of states with this. It seems like intuitive that this probably doesn't work great for a lot of families. You're talking about 180 school days in a year. You're talking about 6 hours in the day. For a lot of middle class or low income families, their hours may not match kind of a conventional 9 to 5. It seems like we're building school delivery that may or may not be what these children need, may not meet the needs of childcare for these families. How are folks thinking about this? And is that a legitimate concern? And if it is, why are we defaulting to kind of stretching schools down rather than embracing other solutions?
Yeah, well, first of all, Celia is great. I agree with her completely, right? I mean, I think, but I also agree with her that it's unintended. I think oftentimes, you go in with the best of intentions. Hey, let's, pre-K, let's expand, access, and then whoops, a couple of years down the track, you realize that there are unintended consequences. And again, I think that, sometimes you may be able to put, spread the peanut butter of pre-K in the way that states are doing, but, people don't have enough information about how it affects the community. So, for example, in one community in one state, we actually did surveys where we went around to all of the providers, just trying to get a sense for, okay, if a local school district actually expands, pre-K, how does it affect the community-based providers there? Because, if you're given free pre-K, parents are gonna choose free pre-K, and that's gonna really crater the market and the options, particularly for parents that really need it. So that doesn't mean that you just don't necessarily want to expand into pre-K. You do, but you have to work to keep that pluralism. You've got to work with CBOs and coordinate and have, first of all, just have the information to understand what's out there in the community, and then give that to the district, and then really work hand in hand with CBOs, with family homes, to preserve the diversity, because that's really critical, because without that diversity of options, then you're going to really potentially reduce the options, and nobody wants that.
So, Chris, just talk me through that a bit. So say you expand pre-K, but then these families still obviously have needs during school breaks, summer break for childcare. Many of these families, a parent, might be a single parent who works a 2 p.m. to 10 p.m. shift or something, which obviously doesn't match with the school provision. And if it's harder for the other providers to stay afloat, once you've put, how do we fill these gaps, the summer gaps, the school vacation gaps, the parents who aren't working an 8 to 2 and a 2-parent household?
Yeah.
Yeah.
Yeah. I mean, the not so good answer is sometimes you don't, right? Like there are, in a lot of different states, there are what is termed access deserts, where there just aren't any options, and that is a real possibility. I mean, I don't think people tend to realize that. And then the other issue is that, people don't even know where these access deserts are, other than the parents who are trying to find the options in those communities. And suddenly they're faced with the fact that for various reasons, they don't have any, or, they got to take, public transport somewhere, and they've got, like you said, that job after hours. And, then what happens is you push into family and friend care, which, dropping off your child with grandma can be okay, but not everybody has that option. So then you are really stuck. And that is, that is something that I think probably everybody on the call can agree we really need to do a better job of solving. And again, making sure that, you don't have these sort of perverse effects when you are really truly have the good intention of entering and supporting parents more. But again, you gotta, because it's a market, you have to understand your impact on the market, and you gotta know how that's going to play out.
Cara, I mean, this seems like one of those places where folks on the right have gotten stuck. We've seen Democrats say, let's spend lots of money on this.
Mm-hmm.
And it seems like the response on the right is often, well, let's not spend lots of money, which doesn't actually do anything to solve problems for all of these families and parents that are wrestling with. So you were talking a little bit before about the difference, say, between government funding and government provision. Can you talk folks through a little bit of, one of the things ExcelinEd under Jeb's leadership has always been good at is helping make sure that folks on the right are actually talking about solving problems for real people. So how do you think about early childhood education in that light?
I think that you can't think about early childhood education without putting families at the center, which I think we're doing in this conversation. But one of the things I would love for the right to be for is really, let's seize this moment. Let's reimagine what a provider is. So the point was just made, right? That there are these access deserts. Let's think about a place like Utah. The government has an appropriation there. They've invested in a program called Waterford. I think it's called Waterford Access. And what they go into rural communities, and for free through this state-funded program, they're training parents how to use a tablet, because there aren't brick and mortar providers, and there wouldn't be now anyway, right? They're really, this is an innovative solution that's not only aimed at helping parents who might not have had an education themselves learn how to, talk phonics with their kids and do all of those things. But this is really reimagining what the delivery system is. Now, if we stay locked in our little box about how do we fund early childhood, and should we spend money on it or should we not spend money on it, that we're never going to get to funding these innovative solutions for the millions of families that have no childcare. I think we should also think about your upper middle class family that, okay, so I might be able to afford to send my kid to pre-K, and if I need to cover childcare gaps, maybe I have a nanny. Maybe I just prefer to have a nanny, and there's some sort of other education function in my house. I think that we need to be, as conservatives, for putting money in the hands of parents there has to be an accountability mechanism, some transparency on the end. So we know that it's not money going nowhere, but to continue to funnel money into systems and structures and bureaucracies that not only aren't really working, but are rapidly changing, it seems to me like a losing game.
Celia, I mean, from somebody who, at KinderCare, you're providing this service across a huge chunk of the country. How do you guys experience this? I mean, what do your families need? How flexible are you? How do you experience this relationship with districts in the manner Chris was talking about?
I mean, it does vary wildly. I mean, we as you said, we're across the country. We're in 40 states in the district. We serve a very mix of families. I would say pre-pandemic, close to a third or slightly more of our families were on childcare subsidies in the various states. That percentage actually, not surprising though, increased during the pandemic because the parents least likely to be able to telework typically have been lower income working families. So like more families have been coming into our centers. We did not close during the pandemic. We had certain centers closed, but we have all 1,500 of our centers are open today, continuing to serve. And we're serving a lot of pre-K children who would be in the free pre-K, but since those programs haven't been operating at all in the public school setting and those families have to work, they've transferred back into the subsidy system in ours. But it is a very interesting push and pull, particularly on the setting piece. And it has been predominantly right now, I mean, the fights have been at what to do with 4-year-olds and trying to figure out, again, like trying to explain to policymakers, like we support serving more 4-year-olds. And how do we figure out how that a parent, regardless of their income level, isn't forced into one choice over another? And primarily what the policies, has been mentioned before, have done is for low income families who under the subsidy system in the states have a wide variety. A low income parent for 0 to 3, they go to faith-based, family care. It can also be a family member, depending on the circumstance. I mean, they've got a wide variety, but somehow they're 4. And the only choice often now is you go into either Head Start or the public setting. And there's nothing, I mean, we need all types of providers to be there because no group of parents are the same. I think the other thing we're learning, and I think we all need to learn more of right now, is I don't think is from the policy perspective, a very good job has been done actually asking parents what it is they want. Most of these programs have been developed by policymakers with good intent, but not actually asking parents, what is it that you want and what is it that you need? And I think particularly coming out of COVID, we don't know what choices have changed for the long term or for the short term, but we didn't, to be honest, know what their reasons were for making the choices before. So before we start to craft something anew and develop data systems and all of that to like, quote, track that, I think we need to step back and actually ask parents what it is they need and then figure out with whatever the subsidies or provision is, how do we support parents in the choices they make and respect that 2 sets of parents may make 2 very different choices for where and how they want to, take the care and education of their 2 or their 4-year-old. And we need to respect that because they best know what their 2 or their 4-year-old needs at that time in their development.
Again, quick clarification, Celia, for folks who aren't, involved in the early childhood world, say a word about how subsidies work in early childhood.
It does. Okay. Well, we'll start the big picture is the federal government allocates to the states a certain amount based on a formula every year for childcare subsidies. That money then rolls down to the states. In the states, there are a number of provisions that they do have to meet. But the states can very much craft their childcare subsidy programs differently. But it primarily has been much more akin to, I always think of the childcare subsidy as akin to a Pell Grant. We call it a voucher or subsidy in childcare, but in higher ed, it would be the Pell Grant. So basically, any provider who meets the criteria, you can take that money with you to the provider of your choice.
Elliot, so one of the things that you guys talk about a lot in your paper, and which has come up several times, is this whole question of data, of what do we know, of what do parents know. Talk a little bit about the landscape on this. How much of this data do states have? How much of this is available to parents? How is this getting used right now? How should it be used?
Yeah, so it's a good question. And I think that what's happened in the system is there's multiple problems, right? First of all, many of the providers are low capacity, so it is hard for them to collect data. They are then sending it into a state agency that is running a data system that might well have been designed before our children were born. And then there's no provision at the state level to combine that data. And even if they can combine data about childcare and preschool, Head Start remains a sort of mystery. And I want to give a shout out here to the folks in Georgia who have worked heroically over the years to get Head Start into their data system, knowing that they can't understand the system without it. And so what happens is, and what's more, there's not a culture of data use. And when there isn't a culture of data use, data collection becomes a bureaucratic exercise rather than a response to a need. So if providers and families were getting good use out of the data, right? If there was a website where you could go and say, oh, like I'm a family with a young child, what are the preschool providers or childcare providers in my area that I'm eligible for and that have a slot right now? If you could get that, that would be worthwhile for people to maintain good data about. But because much of this is going into annual reports that may or may not get read by anyone at the end of the year or tell a complete story, there's not the incentive to collect the data or update the systems. And so it's just not very good. So at multiple levels, there are challenges in data collection and use. And part of our argument is let's try to create a culture of data use, and that will drive improvements in data collection.
And so how should the data get used and what should get collected? And are we collecting the right stuff right now, or do we need to collect different stuff?
So I think one of the biggest uses, and Celia touched a little bit on this, I think, is that we need to have data to help parents understand what their options are, and to help, so that parents can go and look and say, I want a Montessori preschool that is within 2 miles of my house and has a slot right now, right? Or a parent might say, oh, you know what? Like, I just want a home that I can drop my kid off at, and I'm 6 months pregnant, so I need this 6 months from now, right? You can't do any of that right now. I mean, there are some provisions to help, but it doesn't have anywhere near the level of information needed to be real-time help to families at that level. So I would say that's the first thing. And if there's a second thing, it's that for states to understand, right now, if you are a child enrolled in state pre-K half the day and a childcare program the second half of the day, the state knows how many people are in both programs total, but has no idea that you're in both. And so every state that I've talked to would like to just know which kids are getting which services at a given moment. And that if they knew that, it would allow them to manage the programs more effectively to help providers and families.
So, Chris, when people think about data in education, it's usually test scores is what we default to. We want to know if scores went up or not. So, the way Elliot's talking about it, the way you guys tackle this paper, is that not the best way to think about it for early childhood? When we talk about states helping get data and making data available to families, is it something different than test scores, or how should folks understand this?
Well, yeah, this is where early childhood is a bit of a different deal, right? So the way that we think about it is 4 dimensions. First, you have to actually start with eligibility, and frankly, which parents prefer which services, and on the lower income, who's eligible for what? Because when you have an access desert, it actually might not be that there's a lack of physical buildings. It might be that, for example, the working poor who don't qualify for subsidies yet can't, afford private pay. You can put a building there, but they can't, they're not eligible for anything. So you have to really understand the market. So there's eligibility, and then there's access. And in Seattle, for example, there's a huge issue with access because real estate's so expensive here. So you got to sort of figure that out. Then so then you move on to services. Okay, so you've got the eligibility and the market sort of segmentation sorted out. Then you got the kids in the buildings, but then are the actual services, to Celia's point, what the kid needs at that time, given those particular circumstances. And if you can put all that together, then and only then do you look at, say, a kindergarten readiness assessment or third grade test scores, and you should be able to see some results. If you don't, then you go back and you sort of tinker, right? But again, all of this is based on having better information so that you can be able to sort of look across that chain and sort of say, okay, well, where are we here, and how do we again maximize the pluralism of this market to really help parents make the best choices and have the best options.
I mean, especially, well, one of the tensions of this stuff is always like what counts as like quality service, right? This comes up time after time. And, one of the tensions is that when you think especially about places that are access deserts in terms of formal offerings, they may be in places where you actually have lots of grandparents and parents who are interested in providing some of the service, but they don't have degrees, they don't have formal training, they don't have credentials. So, Cara, I mean, how do we think about this when we think about kind of these mixed models, this pluralism? If you've got folks running at-home daycares and they don't have college degrees, heck, they might not even have a high school diploma, how should we feel about the idea that they're providing early childhood education to 2-year-olds? Is that a problem? Is this an opportunity? Help me think about it.
Yeah, I'll have to help you think about it because I don't know if I have an answer to that. But I mean, I think that, I don't think that we should foreclose options that say, I need to have some amount of money to help me pay a provider for income care while I'm at work. That should be an available option. But again, it comes back to the data. And so what I would say is that sort of everything should be on the table. But what I would like to see are parent information systems where there are two sides to one coin, right? And if we think about how the very small number of education savings accounts in K-12 are currently administered, if you start just with the pool of eligible folks, meaning the folks who would qualify for what we might call a voucher, it's really not a voucher, right? Because it's not just about going to a provider. And then you say, okay, we're going to create a system. And by the way, I don't know if government should do this. I think maybe government should contract to do this, how to do it. And it's all about like, maybe that at-home care with grandma is, you get a tutoring subsidy or something like that. So, but you can at least see what categories people are choosing. And a lot of people, if they have access to it, might choose KinderCare. They might choose any range of providers. So we have that. We focus on getting that into a system where, by the way, it's not government or whoever's administering saying to parents, these are the options available to you. It's sort of providers opting in. Like, I want to be available to families. But then families, as you said, have these other options that are more home-based care, what we might think of as non-traditional. But the other end of that is, I do think there needs to be the other side of the coin where we figure out what those outputs are. I do think that K-3, like test scores are very important. We can look at, for example, the number of children that are on IEPs by grade 3, which might tell us something, right? And then you're looking broadly into like, well, okay, kids in the same sort of category, socioeconomic category or social background category, they might have done just as well with grandma and grandpa. They might have done better, right? But at least we have some information about like what they're choosing without limiting those choices. And then down the line, some indicators of quality. And at the end of the day, if we start seeing some places really aren't doing anybody a favor, then they don't get to opt in anymore. But it's that sort of tight, loose relationship that doesn't foreclose community options.
Elliot, I want to come to you in 1 sec on this larger kind of role of government question. But Celia, you guys are one of the nation's largest providers. You're kind of the opposite end of the spectrum from the grandma tutoring. How do you guys think about teacher qualifications, about the regulations around, potty placement and everything else? Like, are these good and sensible measures? Are these counterproductive? How do you think about it?
Let me start with the basic health and safety regulations. I mean, we do support them. I mean, there has to be a floor in an industry that is caring for children as young as 6 weeks of age. I mean, that is just one place where I think government does have a role to play on basic health and safety. Now, are there some outdated, outmoded state health and safety regs? Absolutely. But the majority of those regs are in place because we have seen historically that there is a rationale for, how many children it's safe to have in a room and how many children it's not safe to have in a room. When you get up to the next level, and I think this is where the quality conversation is in a very stuck place, I think in early childhood, there was this movement to create quality rating improvement systems at each of the states. To me, it was trying to, in many ways, I look back, it's like the old AYP of No Child Left Behind in kind of in an early ed structure. And right now, my personal view is the QRS, it fell off the rails about 5 years ago. It got so into inputs layered on top of state health and safety regulations, all, I think, again, intention to say this is an important area of life, and we need all this stuff. But I mean, particularly, I think on the staff qualification issue, we don't have a good answer. There is a raging debate in early ed between whether you need a bachelor's degree in early childhood education or you don't. I would, the National Academy, as much as I love them, did not help putting out a large publication with a lot of stuff, but in the preface basically says, well, the data doesn't really tell us which way to go on this, but we're going to say we want a bachelor's degree regardless because we think that'll get people better paid. I mean, I want people better paid as well, but that's not a reason to, establish a bachelor's degree end all be all. From KinderCare, where we start is with for our own place. Now, this doesn't work in all states. Is we fund any teacher to get the CDA, which is an entry level industry recognized credential, and we ensure that the CDA that we provide to all of our staff is for college credit, so that if they want to, that can stack into later, into an associate's degree, and then they want an associate's degree, onwards. And I think that's a really good place to start for that, given the great diversity you have in early childhood education. I mean, if you look at the early childhood field, it is the most diverse workforce of anything in 0 up to higher ed. And I think we need to be respectful of that, and that if you want to raise levels, which is, I think, perfectly acceptable and probably should be looked at, we need to think about how we use competency-based and work experience to give a lot of people who've been working in this field credit for the skills and knowledge they have today, versus forcing them to go back, put their butts in a seat to earn some credit for some reason I don't understand. But that seems to be where a lot of the states are going right now, and that's a lot of money I think we could better put into some other access points.
So what a lot of this brings up, Elliot, I want to kind of ask you to weigh in on this, and then we'll go. We got a bunch of questions stacked up that we'll start getting to. The way Cara and Celia in particular have talked about this raises this tension between kind of government as a provider and government contracting with other folks to provide it. And, you've talked about some of the dynamics here between kind of predictability and stability on one hand, and kind of the flexibility that Cara's talked about on the other. Curious how you think about this, especially as you try to help states wrestle with provision.
Yeah, I think this is a great issue. And it's one that actually, in many ways, is the flip side of some of the debates in K-12 that a lot of conservative leaders who advocate for charter schools have been on. Because when you look at K-12, there's a system that's incredibly stable and has not historically been as flexible as it needs to be. And there's been a real push to increase its flexibility, and that's a value. On the flip side, in early childhood, the system's always been flexible in a way because programs aren't obligated to take kids aren't obligated to go anywhere, but it's not stable, right? A lot of the providers don't get reimbursed enough to maintain a business model. The pandemic has certainly affected that. So I'm with Cara in completely agreeing that government should not necessarily be providing the service itself, and that it should be thinking about who is the best provider, and if we're, and can we contract with that person. But one of the struggles in the field has been, particularly in childcare, there have been fewer contracts and more vouchers. And there is a place for vouchers, to be sure, but that if providers don't have the certainty, it's not like public schools where, if a kid shows up on a given day, great, but like as long as they're enrolled for the year, the school treats that kid as part of their funding base. With childcare, it's basically like, if the kid shows up today, you get paid for that kid. If they don't, you don't. And if you happen to have all your subsidy kids leave on a given day, you're just out, right? There's no planning for that. So I think what would be really great to see states wrestling with is, how do we, in this pluralistic system, use contracting and use sort of sustainable support to make sure that there are a lot of good options for families with an eye towards stability? Because if you don't build more stability into the system, providers collapse and families don't have those good options.
All right, that's a useful point to keep in mind. Thank you. All right, hey, we got some questions coming in. I'll throw them out there, whoever feels like responding to them. First up, there seems to be conflicting evidence as to the returns to investment in early childhood ed. Is there a significant economic impact for investing in early childhood and pre-K? What do we know?
Well, let me jump on that one first. And I'll say first, I think that actually, I think, raises a really important point for conservatives to think about as well. There is evidence showing, in general, if you want to summarize the evidence, it's that if you do early childhood well, it has a long-term impact. If you don't do it well, it doesn't. Mm-hmm. The big issue is that if you look at the birth to 5 years, those are the most important years for child development. And the research is very clear that the nature of child-adult interaction in those years has a long-term impact on kids. Those things are agreed to across the political spectrum. What's not agreed to across the political spectrum is, what is the role of government in helping children end those 5 years in a good place and helping parents navigate those 5 years? I think reasonable people can disagree about that, but that part of what conservatives in particular should be looking at is, what is the evidence on what works and what does not? How do we support that which works in a way that is respectful of family empowerment and pluralism? And can we use research to get better at this? I would be the first to say there are a lot of states that have spent a lot of money on early childhood services that have not had anywhere near the intended impact. Can we do better, right? I think that's something the question really gets at, that I'd love to see be a trend in the next few years.
And, when we say, when Elliot says that the research suggests that quality early childhood has a payoff, what do we know about the characteristics of that quality? What does that mean?
I think the number one indicator we've seen repeatedly, and Elliot mentioned this, is the child teacher or caregiver interactions. That is, bar none, it's not your degree. It's not, there are some like provisions, like are there enough literacy materials around? I mean, that is important as well. But the number one is that interaction. Is there a back and forth between the child and the caregiver? I mean, that is it. Now, that's a hard thing to measure. We've got one measure out of the university, developed out of the University of Virginia, the class assessment. It's a good assessment. It's right now the best we've got. I think, even they would probably say we probably need additional ways to measure that and assess that. But that in and of itself is the one thing we've seen critical.
Question, what impact would paying family and friend childcare providers directly for the services provide have on the system and on civil society more generally?
Well, presently we do. I mean, there is a provision within the subsidy system to pay for FFN care, family, friend, and neighbor. It's less regulated, understandably, because it's hard to go regulate grandma's home. But I think it has a place. I mean, there are, like KinderCare, for example, we're not open. We don't do second shifts, late evenings, and we're not there on the weekends. But there are a lot of parents who have to work on the weekends and work second shift. And so there is a definite need to figure out these non-standard hours and to do that better. And I think, family, friend, and neighbor, and in some other consortiums, that's an area I think we should be spending some time about how to figure that out, because we've not met that need, and it remains a need for a lot of parents.
Yeah, can I just chime in here?
Yeah.
Sorry to say,
Please.
I totally agree. And I think it could have a really positive impact on civil society. I think we need only look to the few little programs that have popped up during the pandemic that might be referred to as pods. Who knows what a pod is right now? It could be 75 different things. But for example, when the local YMCA raises its hand and says, like, you know what, I'm going to take these kids for after hours and support them in homework and virtual learning and all this. That's the kind of thing that I'm thinking about. And, not every, and some of these programs are charging, by the way. District's going to be closed, but we'll charge you to come in here. And I think that, if families had the ability to make that choice to say, I'm going to do this kind of education coupled with this after school care, what supplemental, whatever it is, that kind of flexibility is not only good for the families, but it's good for the community.
And more generally for folks, again, who don't follow this closely, how prominent is FFN in the conversations right now at state level about use or additional resources as part of the federal conversation? What's the status?
I think there needs to be more looking at it. I think one thing, again, I mentioned this earlier, we have not done a good job actually surveying choices parents were making. And what we don't also understand is when they make a choice, was that the choice they wanted to make, or was that the only option that was available to them? The Bipartisan Policy Center has done some really interesting work in the last year doing some survey, and we're seeing some really interesting stuff, particularly come up about family, friend, and neighbor. I think from the policy perspective, we had always assumed that most of that was friend and neighbor care. What we're seeing in their data is that it was mainly family who's been providing the care historically over this last period. And that's a place that says to me, again, we need to better understand the choices parents are making, why they're making those choices, and is it the choice they want, and then try to build our policies from there.
Yeah, I mean, I'd love to see, I mean, Carol alluded to this earlier, I'd love to see, something on when the child is actually in school, and how are they doing, and then what kind of care did they actually have, and then to be able to sort of understand some of those correct characteristics of those care, to be able to unpack the various sort of origins of where the child comes from. And FFN is a big segment, and one of the biggest challenges is that we know the least about that segment for the most part, right? And so it's trying to sort of figure out, again, how do we understand more about that segment and its role in early education and care, and how that plays out, especially when the child enters kindergarten and proceeds through the early grades.
One of the points we made a bit early on, especially as we've seen in the pandemic, there's both obviously kind of the emotional, social impact on kids, and there's the academic dimension of early childhood education. So question, given kind of that dual mandate, how much of early childhood education time should be academic learning versus play, social, and personal learning? Well, what do we know about that? What's kind of the expert, what's the expert take?
Well, again, I would start the premise, I think it's a false dichotomy, because children learn through play. So I think, there's been this older kind of view of like, how much time should it be like this super structured circle time, or, that we're going to do letters for 20 minutes in the day or numbers for like 5 minutes. I think the field has moved for the most part, and you see this both in center-based and in family care. We know a lot about what a good curriculum looks like for children, and it's not putting a small child, at a desk in an uncomfortable position and, forcing them to write in the wrong way. But it's understanding that in every activity you're doing with a child, even from diapering, the conversation you're having with an infant through that process is important to their verbal development. So everything we do is about, learning.
And Rick, I was honored to have the chance a little over a year ago to write a paper for AEI about social emotional learning in early childhood, which made that exact point, right? That it is integrated, and part of what makes it valuable in early childhood is that, again, whatever the qualifications of the teacher, to Celia's point earlier, everybody really buys into the idea that this is integrated, right? Mm-hmm. And in many ways, when you look at the studies that have been done about early childhood historically has been much better at scale at doing the social emotional learning. In many ways, the challenge is the academic part. And because it's such an important opportunity for learning, as you say, these kids are sponges, they want to learn. And part of what's important is to focus on, every state has learning standards for kids under the age of 5. What are we doing to help them learn what's in those standards so that when they get to kindergarten, they're in a position to be successful in their K-12 schooling?
Hey, so we've got about 3 or 4 minutes left, guys. One of the things I love is if, each of you had kind of one bit of advice for folks on the right who wanted to actually, put forward something that they could feel good about, that isn't about just trying to outbid our friends, our friends on the left. And Elliot and Chris, I know you're not of the right, I get it. You folks who are trying to figure out how to solve problems. What's something at the local level, at the state level, nationally, philanthropically, what's one positive step that folks ought to be exploring or thinking about?
So I'd go back to the point I made at the beginning about getting organized. And if I can use what I think are 2 pretty conservative examples, Alabama is a state that really focused on doing it well and being organized about it, and that they have an outstanding early childhood agency that has provided leadership on what is, by all national accounts, a really high quality preschool program. And I want to give a shout out to my colleagues in Wyoming, where I've been working this last year. They felt like their early childhood programs were spread too far out. They're working hard to get it all into one, or at least into 2 places, and reduce some of the disorganization. So some of that government efficiency part, there are a number of conservative states that have really taken on that challenge and I think can be successful.
I would say that, I'm so sorry, Chris, you go ahead.
No, go ahead, Karen, go ahead.
I was going to say that I think that folks need to know that early education does matter, right? Yeah. And so if you're thinking that it doesn't matter, you probably think it matters for your own family. What you're saying is that it doesn't matter, we shouldn't fund it. I think government does have a role to play, and it's about doing it in a way that honors conservative values, right? So again, government doesn't have to be the provider. It can fund multiple options. We can have this tight, loose sort of approach that honors conservative values, but we have to understand that it does matter. We need to do something about it.
Chris?
Yeah, I was just going to say, I think that just understanding the basics about sort of supply and demand, and to Celia's point about everybody's point about parent preferences, what they really want, getting better, getting smarter about that, and then how to play that role, but while embracing the market dynamics to the extent that, it makes sense. I think that is a real opportunity, and especially in this day and age. So that's what I would encourage.
And Celia, last word.
Yeah, for echoing what others have said, to build off the momentum that Republicans have already built in the last actually several years since working on the reauthorization of the Child Care Development Block Grant like 10 years ago. But even like through COVID, for the first time, you saw large numbers of Republicans, publicly supporting and recognizing the need for childcare in early ed, and to continue to work, build on that. Don't go backwards. Let's build on it, because it is, you cannot get the economy back. You can't grow the economy if parents can't work. And for parents to work, there has to be a safe, nurturing, and good education place for them to have their children. So just build on where they are and go forward is my my mantra these days.
Yeah, no, it's a harsh reminder to those of us who live in places like DC and Boston, but turns out everybody can't telecommute. Some people actually have to go do the important jobs that keep the country going. They need somebody to help watch their kids. Hey, thank all of you so much for taking the time today. I think this has been, a fruitful and really timely conversation. Appreciate the work you're doing and appreciate you making the time. Thanks so much. Look forward to seeing y'all soon.